Hello there, Medicare beneficiary. Congratulations in making it to Medicare Part B. You've climbed many mountains in your lifetime, and now you stand at the base of another, the Medicare Part B mountain. And just like any mountain expedition, we'll start by checking our gear, by understanding eligibility and premiums, then we'll map out our route, exploring exactly what Medicare Part B covers, and we'll also prepare for the unexpected, understanding the deductibles, co-pays, and co-insurances, otherwise known as out-of-pocket costs. And of course, we will survey the landscape by going over the pros and cons of Medicare Part B. So strap on your hiking boots, get some water, and get ready as we trek the Medicare Part B mountain. Now, the first part of the Medicare Part B mountain is going to be eligibility. Most people are eligible for Medicare Part B as long as they're 65 years of age. Other ways to qualify for Medicare Part B before age 65 are things like end-stage renal disease and ALS. I'll link in the description below a full list from Medicare as far as what qualifies you for Medicare Part B under the age of 65. Next for Medicare Part B is going to be premiums. So Medicare Part B is an interesting mountain. If you have more resources, as in more income, Medicare Part B's uphill trek on the mountain, just the path itself, is steeper, just for the premiums. If you make more money than Medicare thinks most seniors need, you get what's called an income-related monthly adjustment amount, otherwise known as IRMA. And every year, that amount does change. I'll leave in the description below the current amount that you have to pay for an income-related monthly adjustment amount based on your income. Now keep in mind that your income that they use to gauge how much your premium costs comes from 2 years ago. They look at your tax returns from 2 years ago to determine what your Part B premium is going to be for the next year. Kind of unfair, but we can at least plan for those things. Next though, we're going to talk about coverage. Now, Medicare Part B is actually one of the most utilized portions of Medicare. It covers things like doctor visits, emergency rooms, urgent care, physical therapy, lab tests, anything that you can imagine that the medical community provides that's outside of a hospital or skilled nursing home, Medicare Part B covers. Now, remember that umbrella, right? It's up, but even as we're on this mountain, we can still get wet. Medicare Part B doesn't cover things like dental, vision, hearing, eyeglasses, and other things that we would consider necessary for our medical. So if you wanted those kinds of things, you will have to buy extra insurance to cover those things like dental, vision, and hearing. I'll leave some in the links down below. Next, we'll talk about Medicare Part B's deductible, co-insurance, and co-pays. Now, Medicare Part B pretty much only has a deductible and then co-insurance. So it's kind of simple. We'll just look at those two things. So the deductible is kind of like your initiation fee to get the preferred cost sharing of 20/80. After the initial Part B deductible, you will pay 20% of all the costs that you incur under Medicare Part B. Sounds like a great deal, doesn't it? But some Medicare Part B services, think surgery, chemotherapy, and if you're on dialysis treatments that happen every other day, those things can become very expensive, right? 20% of a $5,000 MRI is still $1,000. 20% of chemotherapy infusions can still be upwards of $1,000. Now at the end of the video, I'll talk about the Medicare supplement plan that I recommend, which after you pay the Part B deductible, will eliminate mostly all of those co-pays for you. Pretty good deal, right? Stick around. Next on Medicare Part B, let's survey the landscape by looking at the pros and cons of Medicare Part B. Now first we're going to talk about the pros for Medicare Part B. And the number one pro for Medicare Part B is that it covers quite a bit of services. Unlike our first Medicare part we learned about Part A, where it only covers you after admission to a hospital, Medicare Part B covers practically every other service you receive outside of the hospital. Like I said, lab results, lab tests, MRIs, CAT scans, doctor visits, urgent care, all of those things fall under the umbrella of coverage for Medicare Part B. Another pro with Medicare Part B, just like Medicare Part A, is the costs are very transparent. You have a set deductible and a set coinsurance for all the services that you receive after you've paid the deductible. Now let's talk about the cons for Medicare Part B, because this is actually where we find the most problems with just having Medicare Part B. Medicare Part B, again, is a 20/80 cost sharing program, otherwise known as coinsurance. But remember, 20% of a $50 doctor visit, relatively easy, $10. 20% of a $5,000 chemotherapy session is $1,000. And if you need 8 of those, that's $8,000 with no out-of-pocket cap. Unlike when people were on group plans at their work, they had something called a maximum out-of-pocket responsibility or maximum out-of-pocket protection, where if you spent over a certain amount of dollars in one calendar year, the insurance would pick up the rest. Medicare Part B does not have such provision. If you have a whole slew of costs under Medicare Part B, you will be responsible for absolutely all of it, well, to 20% that is. So what I recommend is people purchase what's called a Medicare supplement plan. The two plans that I recommend will eliminate most of the copays once you've met your annual Part B deductible. One of them eliminates them completely, and one of them eliminates all except for a doctor visit and the ER, which are really low at $20 for a doctor visit and $50 for the ER. Well, I hope you learned all that you can about Medicare Part B in this video. Next, we'll go into Medicare Part C, where we will learn about the Medicare Advantage program and private insurance companies now managing your Medicare benefits.